What is autism spectrum disorder? If we break down the word autism, what we get are auto, meaning self, and ism, meaning the condition of. As its name so aptly suggests, it is the condition of self. This is because children diagnosed with autism spectrum disorder have a greater tendency for introversion. Common signs of ASD include poor use of language, gesture, motion processing, eye contact, and beyond that, eye-gaze control. Therefore, among other things, those diagnosed with ASD encounter greater difficulty with successful or meaningful communication. However, as its name also suggests, ASD is a spectrum disorder. On the one hand, you may have a boy diagnosed with ASD completely unable to self-regulate his emotions and senses. On the other end of the spectrum, you may have another boy diagnosed with ASD who is a prodigy in mathematics and can both communicate and integrate with others successfully. It is interesting to note that both of these examples features boys diagnosed with ASD and not girls. Of course, females are diagnosed with ASD, but curiously enough, males are 4 times more likely to be diagnosed with ASD than are females. What causes autism spectrum disorder? Truth be told, the exact causes of ASD are still unknown, but we do know some things. We know that genetics play a critical role in its development. In the case of identical twins, if one were to have it, the other would have a 77% probability. It is in this case of identical twins do we realize that it is not purely genetic. Identical twins share 100% of their genes, so why does one twin having autism not guarantee the other? This would suggest that additional influences for ASD must come from the environment. Today, 1 in 68 children are diagnosed with autism. This is a shocking statistic, considering the number of diagnoses was 10 times smaller only 40 years ago. However, this increase in diagnoses can be attributed to a combination of factors. How we define autism has broadened, as has the criteria of what constitutes a diagnosis. And as our awareness of it has increased, it has become more common to look for signs of autism in early development. In fact, it is the assumption that the majority of people with autism today are adults who are living with it undiagnosed. But also, what is quite alarming is the radical increase in mutagenic substances. Let's examine the word mutagenic. Ik meaning pertaining to, gene, producing, and muta, genetic change. So the word mutagenic is pertaining to producing genetic change. In the past 80 years, the creation of and our exposure to household mutagenic substances has skyrocketed. To quote an article regarding a collaborative research study by the Environmental Working Group and Commonweal, a non-profit and environmental research institute in Bolinas, California, they have discovered an average of 200 industrial chemicals and pollutants in umbilical cord blood from 10 babies born in August and September of 2004 in U.S. hospitals. They state, of the total 287 chemicals we detected in umbilical cord blood, we know that 180 are carcinogenic, or pertaining to producing cancer, 217 are toxic to the brain and nervous system, and 208 cause birth defects or abnormal development in animal tests. This is important data because gene expression during gestation can still be affected by low dosages of environmental toxins, never mind the average of 200 that this study found. What is it like with autism spectrum disorder? One of the symptoms of autism is poor sensory integration. Individuals who are neurotypical, a term meaning pertaining to conformative nerves, process sensory stimulation efficiently and accurately, whereas individuals who have ASD and are not neurotypical often have trouble processing sensory input. For example, an article of clothing with rougher texture may be overwhelming. Similarly, solid foods can cause gagging and present too many issues to swallow. In response to sensory stimuli, the optimal stimulation band displayed here is a model used to illustrate a person with autism's pathway to normal functioning. Too little stimulus results in disengagement, while too much leads to sensory rejection. Treatment options. There are many approaches to treating autism. In this presentation, we will briefly touch on the approach of sensory integration. As stated by Lorna Jean King, OTR-FAOTA, a pioneer of sensory integration therapy, the goal of sensory integrative therapy is to facilitate the development of the nervous system's ability to process sensory input in a more normal way. Like most therapies, addressing the issue at its earliest onset often provides the best outcomes. This is especially the case with sensory integration, so it is important to begin such therapy with children with autism as early as possible. One of the approaches of sensory integration therapy exposes children with autism to new stimuli and variables, incrementally increasing the magnitude and variability of the exposure. Ultimately, the goal is to provide the child with the ability to function in and cope with the wide variety of stimuli in everyday life.